little bit of background. So we are a lab, obviously. We are based outside of Cincinnati. We have been receiving samples from independent pharmacies and specifically CPESN member pharmacies for about the past 3.5 years. When we got started with this program, we were doing COVID testing because there was a big need to do so. About a year ago, we moved from a COVID only test to this current test that we're offering, which is what we call a 3-in-1 test. It is, the technical term for it is a multiplex test, where we take a single patient swab, a nasal swab, not a brain swab or a throat swab or anything like that, and we test that swab for COVID, flu A, flu B, and RSV. So we're technically looking for 4 pathogens. We call it a 3-in-1 just
Oh.
because that's more palatable. But anyway, that's what we're doing. And so what we've attempted to
Sorry,
do
just a
is,
minute, please.
yeah.
Scott,
Mhm.
UC Children's Hospital is requiring masks now.
Yeah, I saw that.
It's coming back.
I know. I know.
Okay, thank you. I'm back.
Oh, you're good. Okay. So, kind of picking up where I left off. So we feel like this is like going to this combined test or this multiplex test has kind of shifted the paradigm a little bit from we really saw people kind of getting worn out, quite honestly, on COVID testing. It was almost like a don't ask, don't tell scenario.
Yep.
And by kind of and by shifting the paradigm to really be focusing more on symptoms that might be causing illness, we definitely got a lot of positive feedback and definitely noticed more interest in testing in general, because the symptoms for these things do overlap. And I think also if you get if you do a rapid COVID test, because of course there are other options out there for testing, and that test comes back as negative, that's all well and good, right? We're relieved we don't have COVID, but I'm still feeling lousy. Like, what's causing it? And so this is kind of a one-stop shop for the most common viral infections that are out there. And what I would probably, I would die on the hill. I would die on Argument Hill over um, you guys as pharmacists being as capable, or in my opinion, more capable than many doctors at consulting with a patient and being able to identify whether the symptoms they're experiencing are bacterial and a Z-Pak is going to take care of it, or viral. And so for those folks who you believe have viral infections because of that, that dry cough and fever and whatever else might be leading to that suspected diagnosis, it's really tough to figure out, of course, what virus might be causing it. So this is a good panel to offer them. It gives them a good idea. The results can be actionable as well, especially for COVID and flu. If they come back positive for one of those, you've got good treatment protocols that you can work with their doctor if necessary to take. And if they're negative for all of these, not to paint with too broad of a brush, but more than likely the patient's got a cold, and it's chicken soup and a blanket and a book for a couple of days to deal with it. So from the patient's perspective, we really feel like I said, kind of shifting that paradigm has been beneficial. I think also from their perspective, fitting this into the pharmacy channel or world does wonders for them, because before this opportunity presented itself, and there were very few good things that came out of the pandemic, but one of them was this realization that pharmacy could and should be a bigger part of the overall healthcare service experience. From that patient's perspective, not having to make an appointment with your doctor, go sit in a waiting room with a bunch of other sick people, pay a $50 copay for the privilege of walking through the door just to get to the same get, basically to have the same experience from that point forward that you can through pharmacy is really, really nice. They don't necessarily have to make an appointment with you guys. Of course, if you want them to, you're free to make that decision. But there are no copays, and maybe most importantly, because when the patient is working with us, there is going to be no out-of-pocket cost if they have eligible health insurance coverage. And what I mean by eligible is active insurance. So
And
if their insurance I'm sorry, go ahead.
oh no, I was just gonna say, so you all, I know from what she explained to me when we talked that they load the insurance information in the app. So
Right.
you all bill the insurance also?
We do. And
Okay.
what we will do before that is we don't do a pre-authorization, but we do an eligibility check. So we're going to ask the patient to enter their health insurance information. We're also going to request that they upload an image of their actual health insurance card. One way or another, we're going to take that information and we are going to verify that that policy is active and that it's not ridiculously restrictive. There are like some Medicare policies out there that they only cover services at a specific doctor or healthcare network or something like that. We can deal with those eventualities if they happen, but we're gonna press pause for a second while we figure that out. But if they have active health insurance, we're going to test their sample no matter what. If ultimately we don't get reimbursed the full amount that we submit a claim for, or if we get declined for some other goofball reason, so be it. That's a cost of doing business. As far as we're concerned, you deal with insurance, you know that some claims don't get paid, and that's just the way it is. We want to primarily focus on patient care first. Knowing too that the patients are your customers and patients, we know that you probably have a relationship with them. So if we do have to get in touch with them after the fact to get, to clear up a discrepancy or something, we're going to have a good chance of doing that. But at the end of the day, we don't do any balance billing. So any unpaid portions of claims, we do not pass that along to the patient, period. So you can tell them that as opposed to going to the doctor and paying that copay and maybe getting charged, getting a balance bill from another lab, this thing is going to come to them at no out-of-pocket cost.
Okay.
So from the patient's perspective, we hope it's really, it's a nice thing to offer. From your perspective, yes, it's an enhanced service that you can offer your patients. And yes, we pay a $20 per sample collection fee or administrative fee. So hopefully it helps you kind of diversify your sources of revenue. And if demand picks up, it can be, it can have a significant impact. But if I told you that you had to spend an hour with each patient, like that's not worth it. So we've been very intentional in how we've developed this thing to be as minimally disruptive to your day-to-day workflow as possible. And so our ask of the pharmacy, and I think Jennifer covered this with you, so I won't go too in depth, is we're asking you guys to act as sample collection points, and that's basically it. We need to get, in addition to the patient's sample, we need to get their information, and we do that primarily through that. You said app, it's technically just a website, but it's a portal, a patient registration portal. We give you a location-specific URL and a corresponding QR code. So your patient walks in, they scan the QR code, they fill out all the information, upload images of their insurance card, ID, whatever we ask for. And at the same time, you hand them a collection kit that we provide to you guys at no cost. There's no cost to the pharmacy for any of this. There are no obligations or minimums or risk. We just want you to have this as an offering for your patients. You hand them a collection kit. That's just a swab, a little tube that the swab goes into after the patient has put it up their nose, and then a bag that goes into to basically protect anybody else that handles the sample from that point forward from what's inside.
Okay.
All of that stuff, the information collection, the sample collection can be done by the patient on his or her own. You don't need to assist, and you don't even need to witness it. Technically, this is a classified as a self-collected sample, so you can send that patient out to their car. If you have a room or an area set aside, they can do it. Most importantly, they don't have to be standing there at the register or the bench taking up space in line, coughing all over everybody. So they fill out their information in that portal, they collect their sample, they turn it into you, and they go home. And then the only other thing that we ask you to do is to put that sample and any others that you might have been turned in that day into a UPS box or bag, depending on what we send you. You put it in a box that we supply. We also supply you with pre-printed labels. You slap a label on there. Those are addressed to us. And then UPS even has a program that they call their pickup point placard program. I get that confused sometimes. I call it Uber for UPS, where UPS sets up a QR code for you. You scan it. It says, we have a package for you guys to pick up, and UPS sends a driver in there, typically right at the end of the day, to pick up the package and ship it to us.
Okay.
And then even though we're in Ohio, we get overnight service from every state in the continental US.
Okay.
And so you put it in the UPS picks it up today. We get it by tomorrow at about 10:30 Eastern time, 7:30 yours. And then typically by now, usually between 1 and 2 o'clock Eastern, so call it, whatever, 10 and 11 your time, if I did my math right there, results are going to go out. So it's a really fast turnaround time from that perspective. We send the results both directly to the patient and to you as their provider. So when the patient fills out their information, they're going to give us their email address, and we ask them for their cell phone number as well. And so when that result is available, they're going to get a text and an email from us. So whichever way they happen to receive it works fine. Say they get the text, it's going to say, this is Mobility Health. Your results are ready. Click here. They'll click a link. They'll put in their date of birth as a secondary identifier, which is required since it's private health info we're sending. And their result report will come up on their phone or whatever device it is they're using. At the exact same time we do that, we also push that result into something we call our provider portal, which is another site that we give you credentials to, where you're able to see any samples that have been registered through your pharmacy, the status of them, so you know when we receive them, when we're actively testing them, and when the results are available, and you're able to view and download a report of those results from your portal, so that if the patient is positive for flu, time is of the essence. As we know, you can take that results report, email or fax it over to a doctor if you're not a test to treat site, and get that script coming to you as opposed to the other guys down the street.
All right.
That's about it. That's kind of how it works. Again, we hope it's really, you're not spending a lot of time with each patient. If the patient is using that patient registration portal, I would be surprised if you're spending more than 2 minutes per patient. If there are folks that can't or won't use that patient portal, they don't have a smartphone or they're elderly and just don't do technology well, you can use that provider portal I was talking about where you can access results. You can use that to help those folks enter their information directly into our system through your portal. Hopefully it doesn't happen very often, but there is more than one way for us to get patient information.
Yeah, it sounds like it's worth a try.
Okay. Have you guys done any testing, whether it's point of care or worked with an outside lab in the past, not just for COVID, but for anything?
Yeah,
Okay.
we've done COVID. We've done COVID PCR test and then the rapid test. We're 20 miles from the Canadian border. So when they were requiring tests to cross the border.
Oh yeah. Yeah. Well, hopefully then that's it's good for a couple reasons. One, that was probably all cash pay. So hopefully, the fact that it can bill to insurance is going to be of interest to folks. But the other thing is, I think it's nice that your patients and customers are kind of conditioned to thinking of you for something like this. Hopefully this is just a little, one, again, lower cost for the patient and hopefully lower just time investment for you.
And guys, like, can we put that link on our website so we could tell people, like,
Yep. So Yeah, you'll get a link from us when we when we set you up, you'll get that link. You can put it on your website, social media, whatever you want to do. And then we'll also, of course, have that QR code for walk-ins. And I see some people that'll put the QR code on their website as well, so somebody can just scan it from their computer as well. But yeah, you'll see when we get you enrolled, we'll reconnect and we'll do a team session like this, but I'll share my screen and I will walk you through how the patient uses their patient portal, how you use your provider portal. We'll walk through how we like samples to be collected and labeled just to make sure that they, that you and your patients are clear on that. But the other thing I'll show you is there are resources that we provide for you in your portal, like that link, like that web link, like that QR code. And then we send you marketing materials, posters, flyers, things like that, because we want to help you promote what you're doing. But we'll also have in your portal some digital assets that you can use to throw onto your website, social media, etc. Really anything and everything that we can do, and there are limits to what we can do as a lab. We give you those assets.
Yeah. Do you have any samples of the, say I do the test, I test positive for flu. Do you have a sample of the letter that we could print out to send to the doctor?
Yep. Here, let me share my screen. Are you in front of your computer?
Yeah.
Share my screen. This is what a results report looks like. This is one of mine, so I'm not sharing somebody else's private health info. Can you see this, or do you want me to make it bigger?
Yep. Nobody I can see it.
So this is it. Patient info at the top, name, date of birth, how we identify the sample, the date and time that the sample was collected at your site, received by the lab, and reported back to you guys, and then the individual results. So this is something that a doctor can use to create an order or write a script for Tamiflu if they were positive for flu A or B, for instance.
Yeah.
So hopefully it's got everything they've needed. We developed this, like the formatting and the information that's on here, in consultation with doctors, because we do this with doctors' offices and urgent cares and places like that as well. The other thing worth noting is if that international travel thing for your Canadian customers ever comes back, or for anybody that's, testing for a reason that's not insurance eligible, like they're going on a cruise or something,